All right, good afternoon, everyone. Thank you all so much for joining us today. My name is Alex. I'm one of the public health educators with the Washington Poison Center. We've got two of our other educators, Megan and Jared, on the back end today. We are here to discuss a pretty difficult and pretty important topic, fentanyl. Fentanyl is our topic for today. Before I introduce our expert panel to help us with this discussion, I want to go through a little bit of logistics and housekeeping. So for anyone who is watching live, whether it's through YouTube, whether it's through Facebook, please ask questions as you have them in the comment section. Now, if everything's hooked up correctly, we should be able to see those questions live. We'll do our best to answer as we can. Now, if you're watching a recording or you think of, or the recording of this, or you think of a question after the fact, not a problem. Go ahead and ask your question anyway. We'll do our best to monitor once this is all finished and do whatever follow-up we can. So with that, I'm going to introduce our expert panel today. They're going to walk us through a lot of the particulars of this substance. So panelists, as I introduce you, please introduce yourself and speak a little bit to the organization you're representing today. So, Erin, let's start with you.
Thanks, Alex. Hi, everyone. My name is Erin Carosa. I work for King County Community and Human Services. And I work on opioid prevention, intervention, naloxone distribution, as well as the most recent youth fentanyl overdose prevention campaign that's been expanded to adult audiences as well, laced and lethal.
All right, now I'm going to go in the order of as I see you all on my screen. So Dr. Phillips, you're next.
Hey, thanks. I'm Dr. Scott Phillips, and I'm the medical director of the Washington Poison Center. And at the Poison Center, we're available 24 hours a day, every day of the year to help you diagnose and provide treatment recommendations or hospital recommendations, as well as education and data collection. And we have our 1-800 number that you can always access, which is right behind Alex there. It's 1-800-222-1222. Thanks, Alex.
Excellent. Thank you, Dr. Phillips. And Allison, how about you?
Hi, I'm Allison Newman. I'm a health educator at the University of Washington Addictions, Drug, and Alcohol Institute, and I do trainings and education on opioids, overdose, and naloxone, and work on the websites stopoverdose.org and learnabouttreatment.org.
Excellent. Thank you. And John, how about you?
Hi, everyone. My name's John. I'm with Teen Link, and basically what Teen Link is this crisis line, but for teens, and they can call in or chat in from 6 p.m. to 10 p.m. every day and just talk about whatever they're going through in order to get that extra support. I am in graduate school right now at Seattle U, and I am focusing on substance misuse and anxiety and depression.
All right. Well, thank you all so much for joining. I know you all have incredibly busy schedules. Props to you, John, for doing this while in grad school. That's impressive. All right, so let's dive into this. So I'm going to start with you, Dr. Phillips. Can you just tell us what is fentanyl?
Sure. Fentanyl is a pain medicine that we categorize as an opioid. So it's a manufactured drug or chemical that's we use it in the hospital to take care of patients with their pain, but it's also found clandestine activity and use and manufacture coming from Asia in through Mexico and sometimes directly, indirectly into the United States. So it's actually quite potent. It's used for very severe pain in cancer patients, and it can be in a patch, a lozenge, or in the hospital. We have an injectable form that we also use there. The illicit forms tend to be mostly these days in pill form, but there are other forms that can come with it. Sometimes it's made in a pill itself, other times as a counterfeit pill. And it's also can be mixed with other opioids or other drugs of abuse that you might see in the street sometimes. So its potency is quite strong. It's fentanyl is about 100 times more potent than morphine, and which is pretty significant. So it takes a small amount, and that's why it's so popular, because it's very easy to smuggle small amounts of a very potent substance and transport it transnationally throughout the world. There's also multiple cousins of fentanyl, and perhaps the most common is carfentanil. There's also methylfentanyl that is out there, and carfentanil is about than fentanyl. So essentially
Oh, it looks like we
10,000
lost.
times
Oh, I think Dr. Phillips is coming back. There you are.
than
Sorry, we lost you there for a couple seconds, Dr. Phillips. I think you were speaking a little bit to carfentanil and methylfentanyl.
Alex, I'm getting a very slow kind of audio from you.
Oh, strange. Just a tech check. Can everyone else hear me okay? All right. Well, let me see. Let's see. What we're going to do, I think someone, oh, there we go. Megan is asking you to go ahead, Dr. Phillips, and we can hear you fine. Right. Well, if the lag doesn't fix up, that's all right. If it straightens out, we can come back to what else you were saying, Dr. Phillips. In the meantime, I know Dr. Phillips had mentioned fentanyl is prescribed and used in hospitals in very controlled settings, and what we are concerned about is this illicit fentanyl use. And so my question to everyone here, really, anyone who would like to speak to this, is why are folks using illicit fentanyl? And if you'd like to chime in, go ahead, raise your hand, and we can call on you first. All right, John, I saw your hand first, so go right ahead, and we'll circle into Allison and Aaron if they'd like.
I think there are a number of reasons why people use illicit fentanyl. I think one of them is it's cheap. I know in Seattle you can get it for about $5 to $7 a pill, and it's going to be a better high than heroin or morphine. Also, too, a lot of people just want to escape. They want to numb out from the world, and fentanyl is like a really cheap way to do that. Also, people that have experienced trauma or just really looking to get a better high. Those are just, in my opinion, some of the reasons why people use fentanyl.
I'd like to try and answer that as well, which is just to acknowledge people often have a wide variety of reasons why they use any drug. Many people use alcohol, which is also a drug. For fentanyl, for any opioid, people may be using it for pain. They may be using it for emotional coping. They may be using it because they have an opioid use disorder. And so using an opioid is part of that. For fentanyl specifically, we have a recent report from ADAI that came out analyzing data and is saying that really there are about 3 groups in Washington who are dying from fentanyl overdose. One is young people who may not know that they're using fentanyl. They may be buying pills on the internet or the street and assume that they are an opioid, like a M30 or Percocet, and actually they're fentanyl. There's another group, which is young people with an opioid use disorder who are aware they're using fentanyl and are using it because they have an opioid use disorder. And then there are older people who have an opioid use disorder, were likely using heroin, but fentanyl is now what's available. So really complex reasons people are using, really varied by age. So I wouldn't say there's one reason, and it's important that we address the different reasons that people are using and not just assume that there's one path or one purpose for people's use.
Thank you. That's very helpful. Aaron, is there anything you'd like to add to any of that?
Yeah, so I would like to add just a little bit more insight into our at-risk youth population, which we did research on for the Laced and Lethal campaign. We did find that our youth who are most at risk for fentanyl overdose may or may not have been using pills or powders that may have or likely would have fentanyl in them. We did find that the youth, as far as their motivations for using, were that there were some mental health issues that some of them were experiencing. Many of the youth who we researched reported having adverse childhood experiences, which could contribute to mental health issues. Additionally, the other motivation for use would be sensation seeking. So we found that a lot of the youth who were reporting that they were either using or buying pills off of Snapchat or social media were interested in having new experiences. Some youth hadn't even tried pills. One of the youth who were interviewed said, her friend said, "Hey, do you want to snort Xanax behind the school?" And the youth said, "Yeah, I've never done that before. That sounds fun." So there were differences in reasoning for, why someone might use. It could be motivated. It could be something that, folks hadn't really thought of. So we really tried to address the different reasons why people might be motivated to use when we endeavored to do this very focused campaign.
Thank you. Thank you all for walking us through that. Now I'm going to backtrack a little bit. Dr. Phillips, I see you again. Can you hear us okay now?
I sure can. Sorry about that.
Oh, perfect. No, it's the nature of this virtual world we work in now.
Yes.
So I think you cut out when you were explaining carfentanil and methylfentanyl, which fits into one of the questions we saw in the comment section. Someone was asking, what is the potency of carfentanil?
Yes. So carfentanil is what we call an analog, or essentially a cousin of fentanyl. Fentanyl was originally manufactured in 1959 by a pharmaceutical company, and it was derived from meperidine, which is the old trade name for that was Demerol. And so it's been around quite some time. This is not a new drug. The analogs tend to be a little more new, like carfentanil, which is used in veterinary medicine, but it's about 100 times more potent than fentanyl. So fentanyl is 100 times more potent than morphine, and carfentanil is essentially 10,000 times more potent than morphine. So we have seen it around. It's incredibly potent. It takes just tiny amounts to cause great harm to people, and it's certainly something that's quite dangerous.
All right, thank you for backtracking there with us, Scott, or Dr. Phillips. All right, so our next question, I'd like to speak a little bit to some of the trends we're seeing. That's why we're meeting here today. So it's kind of a two-part question. What are we seeing in King County as far as fentanyl trends, as well as Washington State on the whole? Who would like to answer this first?
I can speak to statewide. I have not looked at the King County data this week, but statewide, we've seen a more than doubling in overdose deaths among people under 30 in the last 10 years, and the majority of that is due to fentanyl, and the majority of that rise has really come just in the last few years. We've also seen a big increase in deaths among people over 30, so about a 50% increase. Those are shocking numbers. That's really bad news. The death rate for people under 30 from fentanyl is very similar to the death rate for people over 30, which is not something we see with other causes of death. That's a reason why communities like King County are focusing on a youth campaign, because that's a very dramatic and concerning rise in deaths for younger people. We are seeing fentanyl-involved deaths happen across the state and in all different types of communities and across different ethnic groups. We've seen overdose deaths rise even more for Black people and American Indian Alaska Natives in Washington. So this is something that affects all communities, but it's affecting some communities even more.
Thank you, Allison. Anyone else?
I think just to add, generally speaking, it's just become more common as far as something that is found in King County. And so the incidence across King County is definitely affecting the increase in overdose deaths due to fentanyl or fentanyl-involved overdose. And it's just one of those substances that, if it's the first time or the second time, or, if you have much experience with using the substance, one pill can be very different from the last pill or from the same batch. So we really talk about being able to prevent overdose by not using, by knowing what's out there in King County. But for folks who are not going to be influenced by a prevention message, that's when you would want to have harm reduction strategies. And so that's why we're really talking about knowing the signs of overdose, as well as how to use naloxone and how to help a friend, because we can't use naloxone on ourselves. We need someone there to help us. So it's really important to know kind of where you're at personally, as well as being able to provide a spectrum of resources and information to meet people's needs.
You know, Aaron, John, please go right ahead.
I just wanted to kind of piggyback on a little bit about what Aaron was saying, just about like how like each pill is different. And that's like what makes them so dangerous, is because when they're being created illegally wherever, the cartels or whoever's making them is just mixing them all together. And so some pills might have nothing in them, some pills might have a little, and then some pills may have a lot. So every new pill you're taking, you are literally risking your life. And I think that's one of the aspects that makes fentanyl so dangerous, is just because you don't know what you're getting. There might not be nothing in there, and then it just might be loaded with fentanyl. Who knows? But I really just like how Aaron covered that very well.
Thank you all. Now, I'm hearing all of you speak to the pill form of fentanyl. It seems like that is the primary form with this illicit version of this substance. Are there other forms any of you want to speak to? Or are the pills what we're really focused on and concerned about right now?
Well, there are, you can make liquid forms for injectable, and some people do like that because it has more of an instantaneous punch than pill forms. But liquid is much harder to distribute. It takes a larger volume. The powder form is much easier to conceal, much smaller volumes, and so it's kind of the preferred modality and form that you see it in now.
I would say too that geographically within the U.S., there's really big difference in where fentanyl is showing up. So originally in the U.S., about 5 years ago, fentanyl was showing up in powdered heroin in the Northeast and Midwest. We tend to have more black tar heroin, which wasn't as likely to have fentanyl in it. So there's really big differences based on what part of the country you're in. However, fentanyl can be in really any drug that you're not getting from a pharmacy. I do see a question about fentanyl and black market marijuana. That's not something that we're seeing. It doesn't seem to be contributing to deaths. I think that's something that does come up as a question, but is very, very unlikely and not something that we're seeing in the data involving overdose deaths and overdose in general. Really in Washington, the biggest concern is in these counterfeit pressed pills that people think are, regular opioid, or they know it's fentanyl, but they have an opioid use disorder and they're continuing to use because of that. One thing that wasn't mentioned about fentanyl that I think is really important is unlike other opioids, it's much shorter acting. So people who have an opioid use disorder, which means that they are using despite negative consequences because they are dependent on it, they may have to use much more frequently than someone would who's using heroin. So every time they're doing that, there is a risk for overdose. So it's the shorter acting nature of it is also a contributor to the increased risk for overdose.
Yeah, actually just tagging on to what Allison was saying there, one of the interesting things, even though it's the duration of euphoria is fairly short, its clearance from the body is actually not. It's many hours. And so we'll see this in the hospital that people are on a continuous infusion, for example, for severe pain, that they'll actually build up, and you can have accidental overdose deaths just from the buildup of fentanyl. So if you use it frequently, the metabolite is still building in your system, and you can overdose in that regard as well. So it's dangerous either way, first hit or repeated hits.
Right. Thank you all for weighing in on that. So I'm seeing a couple questions pop through. One through Facebook is, does the group feel that there is still a shortage of prescribers for medication-assisted treatment or medication for opioid use disorders?
I can jump in if no one else wants to. Data shows that most people with an opioid use disorder are not receiving the medications for opioid use disorder, which the ones that have the highest effect at reducing overdose deaths are buprenorphine, which is also known as Suboxone, and also methadone. And we know that the large majority of people with the opioid use disorder are not being prescribed or dispensed those medications and aren't getting the protection that they need and the chance to really have, stability and improve their quality of life and health. So I would say, I think there is still a shortage of prescribers and also barriers to people having access to care.
I think that's right. And there's also geographic barriers. If you look at the distribution of trained prescribers, it varies significantly. So there are some counties where you may not have anyone available. And it's particularly rampant in some of the rural counties per capita. So we definitely need more people trained to provide this therapeutic approach.
Right. So kind of a big question I have that should link with one of the questions we're seeing on Facebook here. Does anyone have theories as to what's driving these trends? Why we're seeing more and more and more of these fentanyl cases over time?
Well, it's cheap. It's cheaper than heroin. It's cheap. It's easy to smuggle. It's everywhere. Dissolves in a lot of things. And so, and you also have to understand that people that are selling and dealing this are not necessarily true brokers of commerce here. And you don't know what you're getting from these people. And so they might be thinking they're getting, a generic alprazolam or Xanax when in fact they're actually getting an opiate. And so there's a lot of confusion and mixed illicit marketing in these products.
Thank you for addressing that, Scott. Dr. Phillips, is there anything else others would like to add to that?
I would just add that we were seeing a rapid increase in fentanyl deaths before the pandemic, but likely some of the opioid use and overdose deaths were exacerbated by that. And that's because people were socially isolated. They may have had job loss or a loss in housing. They were physically isolated, which we know can increase someone's risk for dying from overdose because there may not be someone to respond. So we have really increased availability of fentanyl in a situation where there's a lot of instability in people's lives. People may have been more likely to relapse or start using opioids again, people who had stopped. So I would say that those two things combined were pretty deadly.
Thank you. And you totally wove the question on Facebook right into your answer there. The question was, is the pandemic exacerbating lack of access to care? So thank you for that. Now, John, I saw you unmute yourself. Please.
Yeah, I was just also going to say, and I know it's been mentioned too, is like why we're seeing so much fentanyl is it's found in other substances, like other illegal narcotics or drugs. I've even heard people saying that they're starting to put it in meth just because when you give it to someone, they're going to come back quicker because that high they're experiencing from the methamphetamine isn't going to last as long with fentanyl put into it.
Right. Thank you, John. Now, I'm going to take a couple steps back. Aaron, earlier when you were speaking, you were talking about shifting when appropriate from prevention to harm reduction. So my big question then is, what should someone do if they think someone might be overdosing from fentanyl or other opioids?
That's a really great question. And my wonderful colleague, Allison, is the one who trained me on how to address that. So, knowing the signs of overdose is really important. And there are some amazing resources and training available 24/7 video resources at stopoverdose.org. There's a really great brochure that kind of walks you through the signs of overdose, talks about what is an opioid, what is naloxone, what to do if you think someone is overdosing and going through the process, and just how to render aid, as well as information about the Good Samaritan law. So you asked about prevention to harm reduction, and we did find with the youth population that there was the opportunity to provide prevention messaging, that it was compelling to know how strong fentanyl was, that the pills that were available for sale on Snapchat, where they were getting hit up by dealers on the platforms that they were using, were not necessarily or likely to not be from the doctor or from the pharmacy. And just being able to convey factual information to youth in a non-judgmental way to let them make an informed decision was very powerful. But if youth might be already using, then prevention may be less of a message that could be effective for certain populations. And those are the ones you're going to really want to make sure have the information about what does an overdose look like? What can you do if an overdose is encountered? Naloxone, how do you use it? How do you get it? All these things are really important information resources to address.
Aaron, can I ask you if you would just describe the King County naloxone program briefly for people that may not know?
Sure. So we have a really great partnership with Cali Ross Pharmacy, and we have a contract with them to provide a platform where folks can actually order naloxone online for free in King County. So if you go to lacedandlethal.com, there's a link there to order naloxone. It takes you directly to that hosted site at Cali Ross, where we ask for minimal information. You can order up to 2 kits, one for yourself and one for a friend. There's also the opportunity to walk into 2 Cali Ross pharmacies in King County, so the Polyclinic and the Union Center pharmacies. You can mention Laced and Lethal. Again, we ask for minimal information. We make sure that you're a King County resident, and you can get up to 2 kits, one for yourself and one for a friend. It is not just for youth populations, but also adult populations. So anyone can get naloxone. And then stopoverdose.org is a really great resource as well, which highlights other places that you can get naloxone. We're also building some local community partners. Friends of Youth is one of them, that folks that are going to distribute information about the Laced and Lethal program to youth, as well as be a provider of free naloxone in their community. So folks have better access, just being able to walk into a community-based organization in their neighborhood and get access to naloxone.
Excellent. Thank you for walking through all of that. And there was I'll just read this out loud for folks who are listening. Someone asked the question, can people get this free naloxone in Snohomish County? And Allison, thank you for replying there. Yes, there are options you can find at that website, stopoverdose.org. And you can also go to a pharmacy and use the standing order that applies to everyone in Washington, all Washington residents. And I will speak just with my personal experience with that website, Laced and Lethal. A few months back, I filled out the information and ordered it, and about a week later, it showed up in my mailbox. So it's incredibly easy to use. So thank you for sharing that out. All right, folks, I want to be cognizant of time. We've got a couple minutes left. I want to give some space for any last questions. But as folks are thinking of their final questions, I have a couple more. And so one thing I want to touch base on, if you're just out in the world and you see someone you suspect might be overdosing and you want to intervene, I know there's concern that opioids in general can be absorbed through the skin, and so that someone might not intervene because they're worried that they might get exposed as well. Would someone mind speaking to that? Is that a possibility for opioids to absorb through the skin in that way?
Sure, I'm happy to take that head on. So this has been a recycled rumor for quite some time, and our toxicology organization had a position paper on this many years ago. And the actual data on transcutaneous absorption or through the skin absorption of fentanyl is remarkably small in a powdered form. To get it through the skin, it actually has to be manufactured specifically for that, and that's in the form of the prescription form patches of fentanyl. So street fentanyl, the powdered form, the pill form, does not get absorbed through the skin to any appreciable degree. That said, I would ask people to use gloves if they have them when they're dealing with it, just for other reasons, as well as the medications that might be there.
Excellent. Thank you for walking us through that, Dr. Phillips. And one final thing I'd like to say just about Narcan and naloxone specifically, just because I think this is such a cool intervention. It's just, I really want to amplify that idea that someone doesn't have to be experiencing an overdose to administer Narcan. Like it's not going to harm them if there are no opioids in the system at all. I haven't had a poppy seed muffin today. Even if I administered Narcan right now, I'd be just fine. So it is an incredibly safe form of intervention there. All right. So my last question to everyone here, as you know, folks on Facebook are thinking of their final questions, is for each of you, what is one thing that you want viewers to take away from today, from everything we've talked about today?
I don't have one thing, but I have a plug of a few. Oh, you can go ahead, Dr. Phillips.
Right. I guess the one thing is, it's hard to trust street drugs of any form, but fentanyl in particular is one that can kill with a single use, and so you have to be extremely cautious about what you think you might be purchasing on the street, and that's why there's great resources that Allison and Aaron's organizations provide. So I'm really thankful that we have that. So Allison, what do you have? What's your takeaway for this?
Yeah, my takeaway is if this is something you're concerned about, which I think we all should be, try and learn more. You can get naloxone to have so that you can save a life. And that we have, although treatment is not perfect, we do have good options for treatment in Washington. And if you're concerned about someone, or if you yourself would like to cut back or stop your opioid use, you can check out the Washington Recovery Helpline. They have a locator where you can find options for medications near you. So there are a lot of ways to address this problem. This isn't something insurmountable. And if there's someone you're concerned about in your life, just go ahead and talk to them. Share what you learned today about fentanyl and naloxone.
I think one of the things I would say is just like really being aware and spreading awareness about fentanyl in general. I've talked to quite a few people, and they just didn't seem to understand that what fentanyl was or like what it looked like. And unfortunately, like I think a lot of deaths have happened for people thinking, oh, this is just an Oxycontin or a perk or whatever, or just a regular sleeping pill, because it really does just look like a regular pill. They have a pill press. So just really spreading awareness about it and knowing what it is in order to have people be more informed. That's what I would say.
Thank you, John.
And then I would just also just re-highlight, make sure, you educate yourself. If you are a parent or an influential adult, find ways to have conversations with your kids or youth, because information saves lives. Youth really want to be trusted with information. And we really found that in the research that we did with youth at risk for fentanyl overdose, they really weren't aware of all the things that were going on. So that fentanyl was so common in pills and powders in King County, that it was as strong as it was. There are a lot of ways that you can influence positive and healthy change in the lives of youth specifically. So I would just encourage everyone to have those conversations, have them often, make sure you're non-judgmental, and just provide support. let folks know that there's more information, there's ways to get access to naloxone, and these conversations will further help everyone to have more open, honest conversations and reduce stigma overall.
Absolutely. Thank you so much for that, Erin. Now, I'll just read this question out loud. Allison already answered it in the chat here. Someone asked, how much does naloxone doses cost? And Allison said it's free if someone goes to a community organization, or free at a pharmacy with Medicaid. Private insurance varies a lot, so there could be some cost if going through private insurance. Excellent question. Now, we are over time. I don't want to keep folks on longer. So I just want to say thank you to all of you who've joined our panel today. Thank you to all of you who have tuned in. And my last takeaway from all this that I'd like to share, a few different points. You all have spoken to the importance of approaching this without stigma, without shame, and with empathy. And so my takeaway from that is approach this with kindness. Be kind to one another, and stay safe out there, everyone. Thank you all so much for tuning in.